Now, decisions in the primary care settings is actually very simple. You don't actually make that much of a decisions, which is very nice. Unlike other medical specialties, there are only 4. We saw it just now when we do the mini case, right? We can reassure, or we can call that expectant management, or we can do an intervention as a PCP, or we're gonna do workup, right? Blood ultrasound, CT urograms, etc. Or we can do referral. And the intervention as PCP is gonna be very, very basic. It's not going to be that complicated. Some people do procedures, but it's going to be a mini procedures. The issue here is if you do the reassurance and if you do intervene as the PCP, the great thing here is that the cost, this one is a low cost and low time options. On the right side is a higher cost and takes more time. Now, one of the exception here is the workups. These are basically labs, TSH, CBC, CMP. They're not that expensive. So I can probably put more on this here is the advanced workup. This probably would be like stress tests, imaging, MRI. Okay, those more advanced workups. That would be more expensive, taking a lot of cost. There'll be more wait time. Right? And if you see referral to specialists, there'll be more cost and more time taken. However, if you do this left side, there will be a higher risk and liability. The right side is lower risk and lower liability. Think about it this way, like the one with the gross hematuria. If you decide to reassure, but the correct answer is actually referral and cystoscopy, you will miss the bladder cancer. Well, reassuring and not referring would actually reduce the cost and reduce the time, but you can see how risky it could be if you make that mistake. If you want to be safe 100% of the time, refer everybody. Do all the workups. Do the CT urogram, the MRI abdomen, do the referral to urology, chest pain, cardiology, headaches, neurology. You're not going to manage anything. There's low risk. This means you have no liability because it's the other person that is being managing. You're not really doing much, right? You're not intervening. And then if you do the workups, you can always say, I've done the workups, but it has a higher cost and takes a lot of time and it's a burden for the patient. If it's not necessary, we don't want to do that. Now, balancing these two is the value-based care.